Hello everyone, this is Dr. Jayanthy from Tamira Plastic Surgery. So I have two plastic surgeons with me here. Both of them are board certified plastic surgeons, finished starting their practice, and he's already into practice. In plastic surgery, learning doesn't stop with just getting a degree. We continue to learn. Even now we travel across the country or out of the country to learn the newer technologies. Either it's medical equipment that is recently introduced or it's technology, and we're trying to learn. So I just wanted to understand how the training that they came here for exposure in Tamira helped them. So doctor, can you tell me, you're into practice, so how do you think that this 1 month that you spent with us helped you?
It helped me a lot, especially with respect to the non-surgical aspects. You have all the latest machines. I have never seen this many machines anywhere.
No, but you're having the latest machine,
and
right?
But to use them properly, to have the patient load that where you can use all these machines, all that is important, and that you have also.
So, being a plastic surgeon, I'm sure your main core interest was, initially you thought it's all was surgery.
Surgical, yeah.
But how do you think now the connection between the non-surgical that you saw and surgery?
It's a nice complement. Both are complementary to each other. It's not exclusive.
Yeah.
You need to have both for having a full-time aesthetic practice.
Because the surgical patients, for them there is more requirement, even with surgery, if there is a hypertrophic scar, how we are dealing with them. And the same patients, you can deal some of them with surgery, but there's always a lot of scope with non-surgical. And you have seen in this 1 month, there's many patients also prefer non-surgical. Probably at some other later time, they prefer surgical, right? So this is a comprehensive training. And I would like you to understand that, okay, now that you had this exposure, will be your future plan as you go?
My future plan first would be to develop a nice patient base with more consumables like fillers and thread lifts and all that, and slowly go into these machines and to buy the machines. And
so building the practice, focus being only to deliver the best results that is optimal for the patient and what the patient wants. And so I think that is what we like to teach from here. To build the practice when it comes to aesthetic work. We don't do too much. We also do things that gives the best results, right? Yeah, thank you. You tell me, doctor. So, what do you think is, if there is one thing that actually made you think it's worthwhile that you spend this 1 month here?
Actually, my major choice I made to come to Tamira was because it had both surgical and non-surgical exposure, because we have no non-surgical exposure whatsoever. So that was a main factor to come here. But the major takeaway from this 1 month is actually how you interact with patients, and because I have not worked in a private setup yet and I don't have a setup as of now. So to know how to talk to a patient and how to offer treatments to a patient. So it's not about having the machines and everything, but the patient has to opt for it and come for it again. That was a major takeaway, how to consult a patient, how to manage complications. Complications are going to happen. So how to manage all those things, how to manage an unhappy patient, all those things are very nice things that I got to observe in this
I think that's the very, very important part of the whole training, doctor. So you're all trained already, and all of you can do all the surgeries yourself.
Yeah.
But that the part of going further and learning is not. All of us want happy patients. To make the patient happy, first we have to understand the expectation, because not everybody has realistic expectation. There are so many influences giving wrong ideas, and everybody thinks it's just on a touch, everything transforms, and there is no way anything is going to go wrong in the process. And they also do not know that all these claims with so many influences are not true. Right? Every procedure has its limitation. We don't have one procedure you do one time and the rest of your life you remain as it is. Of course, some surgical results can give you a permanent result, but that permanency itself is not permanent, right?
Yes.
You might have a great abdomen after an abdominoplasty, but if you add weight, again the results is going to, over a period of time, not be the same. So this is something that you have to understand. So at Tamira, we offer training. It's like giving back what our mentors taught us. So we like to give it back. There are about 350 plastic surgeons coming out every year. So it's our community that we are trying to build, that all these plastic surgeons together are trying to deliver the best possible result. So you have recently witnessed death after hair transplant. That's because when you do a research to find out best specialists to offer aesthetic work, you need to know that both certified plastic surgeons are the ones who are trained both surgically and non-surgically to offer the entire spectrum of aesthetic work.